Hi everyone, I'm Dr. Ashley Spooner. I just got back from an incredible experience at the American Dental Association headquarters in Chicago. And I wanted to share what this moment means for the future of sleep medicine, dentistry, and the millions of Americans who are still living undiagnosed with sleep apnea. This was not just another conference. This was the Sleep Airway Summit, a meeting of some of the most influential leaders across dentistry, medicine, neurology, orthodontics, pediatrics, technology, and medical insurance. And I was honored to be asked to be a part of it. We met inside the beautiful ADA facility, where for an entire day, the focus was simple. How can we work together at scale to help treat the more than 70 million Americans who have undiagnosed sleep apnea? So why was this meeting such a big deal? Well, for the first time, the ADA is intentionally bringing together dentists, physicians, sleep specialists, payers, and innovators to help remove barriers that have slowed our progress for so many years. As ADA President Richard Rosado said, airway is exactly the kind of area that brings together the best of our disciplines as dentists. And he's right, because airway is central. It affects everything from childhood growth to cardiovascular health to the way we breathe at night. And we as dentists look at airway all day long. So what are my key takeaways from this summit? Well, first, dentists are essential in solving this public health crisis of sleep apnea, being undiagnosed and untreated. Steve Cartensen reminded us that dentistry plays the most important public health role in identifying sleep issues, especially in our kids. We talked about the importance of using screening tools like Stop Bang, Epworth Sleepiness Scale, the Pediatric Sleep Questionnaire, and how many dental schools like UOP with Dr. Audrey Yoon are already making sleep screening mandatory. This is great progress, and we just need to continue to build on it. We also discussed medical-dental collaboration, and it's no longer optional. We heard from the Mayo Clinic's Dr. Geary about the need to prioritize both the individual patient and the broader health system. Physicians, dentists, and specialists must stop working in silos. We need unified messaging, unified screening, and unified workflows. And the big message from Dr. David Schwartz, patient choice matters. Many patients are removed from the decision-making process, and that has to change. We have plenty of options to be able to treat sleep apnea. We also need better systems and evidence. Payers like United Concordia emphasize the need for stronger data. Who benefits the most from treatment? How do we close the loop between medical and dental care? How do we reduce costs while improving outcomes? And the data is already compelling. For CPAP users, only 26% of patients stay compliant after a year. While with oral appliance, there's much higher compliance rates and lower long-term costs. There's over 1 million CPAP machines prescribed annually, yet millions remain undiagnosed and are not compliant. We need better evidence, better workflows, and scalable solutions. And innovators like Sleep Architects, Wesper, AppsMe, and others are helping to lead that charge. The ADA is ready to lead. This was one of the most powerful parts of the day. With initiatives like Oral Health 2050, the ADA is focused on advocacy training, education, policy development, and unifying dentistry's voice around sleep and airway health. And that support is huge. What this means for the future, having all these players, dentists, physicians, neurologists, orthodontists, payers, and tech innovators together in one room, was the most important step toward real progress. More screening, better workflows, improved education, increased access, better coverage, and ultimately, treating more patients. This is how we help people sleep better, feel better, and live better. I was so inspired when I left. This summit confirmed what so many of us in dental sleep medicine have known for years. Dentists are key players in solving the sleep apnea crisis. We see our patients more often, we screen earlier, we recognize the signs that are often missed, and with the ADA's support, we now have a unified path forward. I'm proud to be a part of this momentum, and I look forward to continuing to work with leaders across disciplines to make sleep and airway care accessible to more patients. If you're a dentist, a healthcare provider, or even a patient trying to understand sleep better, stick around. We're just getting started. Thanks for watching, and as always, follow on Instagram and subscribe on YouTube, and sleep better, feel better, live better.